Hello to all of my loyal viewers. God, if only I could actually make money doing these video blogs, that would be amazing. Vlog, sorry, use the correct terminology here. So it was a very busy day today. I worked all last night. Thankfully, I was on a one-to-one, and I had a wonderful patient who ran into some tough luck and is making some really good decisions to get her life back on track. And she was just such a nice person. So it was just very comforting to be around somebody who is insightful enough to better their situation. So worked all night, and then I went and met up with my friend Wendy, who I have not seen in years. She had some goodies that she was giving away, so there was a cute little tea set, and I'm kind of obsessed with tea sets. So I got the let's see if I can show a picture. I have to clean it up a little. It's a little bit dusty, but let's see. Get one of the, let's see. This is the sugar bowl. So a nice cherry blossom print, which I'm a huge fan of. So there's the sugar bowl, the teacups, the plates. So a nice little treat for myself. And so after that, I went and had my CT scan done. That was just a quick in and out. Each time I have one, it seems to go a little quicker, which I guess is a good thing. Had some time to kill, so I decided to use it wisely and make a trip to Costco. Filled up my gas tank, got the air in my tires checked, and bought some groceries and such. And then from there, went to meet up with my pal, Dr. Lash. So what it comes down to is they are going to do chemo, which will start next week. It's a combination of infusions and pills. So look at my notes here. The two medications I will be taking are eloxetin. The generic name is oxaliplatin. I'm probably saying that wrong. And that one is the infusion. And the other is, brand name is Zoloda capecitabine. And that's the pill. So it goes in kind of a rotation where I will be doing a week of infusion. So I don't know if that's every day for a week or if that's like once a week. I'm not sure. And then for 14 days, I will be taking 5 pills in the morning and 4 in the evening. And then I will have 1 week off from any medication whatsoever to kind of let my body, I guess, regroup before it gets hammered again. So he tells me that there is no hair loss. However, looking online, it says that your hair can become thinner, but it comes back when you're finished with your treatment. So I guess we'll see. My hair's already kind of thin. As I age, it gets a little thinner and a little thinner. My mom had very thin hair too. Now my dad, on the other hand, my dad had like the perfect coif up until, or I'm sorry, I think Jay calls it the perfect pompadour, was how he referred to my dad's hair. So he had a pretty good thick head of Italian hair. I kind of got maybe a mix of the two. So, we'll see how that happens. I'm also told that I'm not sure whether it's the pill or the infusion. I think it's the infusion. Causes a sensitivity to cold. So for 48 hours, I am not to have any cold food or beverages, which sucks because I live on ice water. He says there'll be some fun things like a decreased appetite, diarrhea, woohoo, cha cha cha. Could possibly get a rash on my hands and feet, and they recommend using a good moisturizer to deal with that. Apparently, the infusion is going to be a 3.5 hour treatment. I have to do an education visit first to meet with the nurse to get more information on the side effects and how the process is going to go and what to expect and all that good stuff. Dr. Lash tells me I probably will not need a port because I do have good veins. So, well, I have one definite good vein. My right AC is kind of the go-to. So hopefully we don't ruin it by jabbing me once a week or however many times a week I have to get the infusions. What else? So he says they're going to do 2 rounds of the treatment. So that'll be about 2 months. And then do a rescan and then see how it looks, and then probably another 2 months of treatment. And he mentioned radiation. I'm not really sure what they're going to do with that yet. I still have to meet with that provider and see what their take on the whole thing is. And then after all that, they'll end up going in and hopefully then do surgery to get rid of whatever's left after the chemo. So the point of the chemo then is to shrink. I guess it's considered a tumor. It's like, I don't know, necrotic tissue, and I guess more like a lesion than a tumor. I don't know if that's considered a tumor. I always think of a tumor as being like a lump, a blob of some sort of tissue, where this is actually like the tissue sort of being eaten away. They're also going to send some of the biopsy for, it's called Foundation 1, and that is, that digs into the DNA. I'm not really sure, again, where that all comes in and how that affects the treatment. They did get the results back from the protein mismatch, which all came back clear, or not clear, but like my body is dealing with mismatched proteins the way it's supposed to, basically. And I think he said that because that is the situation, that they wouldn't do immunotherapy, I think was what he said. So, yeah, I've got a lot on my plate. Oh, the other thing he described was as a side effect was fatigue. The big things are going to be the appetite and the fatigue, and the diarrhea. Good times. So I definitely do see myself missing some work. He said that as long as I'm doing all of the masking and typical COVID PPE, that I don't have to avoid COVID patients, because I've had a couple of one-to-ones in the last week, and I think two of 4 of them, I think, were COVID positive. So, they're definitely out there, and I'm sure I'll still end up having them being in their presence. But I am already very careful as far as lots and lots of hand washing. Of course, that's going to be an issue too, to be washing my hands so much and having the rash or dry skin or whatever is going to come from the chemo side effects. So, I don't really know. I'm just kind of looking at these. They printed off some information on the medications for me, and oh, good. One of the let's see, eloxetin is classified as an alkylating agent. Alkylating agents are most active in the resting phase of the cell. These drugs are cell cycle nonspecific. There are several types of alkylating agents. Mustard gas derivatives, and then a bunch of other stuff, but that's, I don't know, a little scary. Mustard gas derivatives. Oh, God. I guess I've put worse things in my body. I don't know. Let's see. So 9 pills. It says here, taken by mouth, take after food within 30 minutes of a meal with water. Do not crush, chew, or dissolve. Well, definitely don't have to worry about me chewing the pills. And by the way, this type of medication is typically used to treat colon cancer, rather than like a bladder or urethral cancer. So, not really sure why they use it, but apparently that's what works. So here we go. So that's what's happening. I don't think I had any other interesting information or updates at this point. So once I know a little more, we'll do some more updates. We'll see how I react to the chemo, and take it day by day, I guess. All right, I'm getting ready to cry, so I'm gonna end this. I am wearing my Burrito t-shirt today. Just got home. It's about, I don't know, 2 o'clock-ish, 2:30. So I got home around 2, I guess. And I'm up almost 24 hours at this point. Another half hour, I'm up 24 hours. That can't be good for me either, I'm sure. And I'm probably not going to be able to pull these 24-hour days once I start treatment. I'm already exhausted, so I can't even imagine what kind of fatigue I'll be experiencing once all this starts. So if anybody has any experience with using or taking either of those, the infusion or the pills, again, it's eloxetin or Xeloda. Feel free to share your experiences with me. You can inbox me or PM, DM, whatever the hell it's called. I don't know. There's all these different names for this shit these days. Or, if you've, I don't know, any chemo you've experienced and what your what kind of side effects you've had. I guess I feel like I need to know what to expect. Everybody's, I guess, going to react a little differently, but I don't know. So I might try to take a nap. I could probably use it. And I got a couple days off, so I'm going to try to reboot a little bit. I got some plans with friends over the next couple days. This is weird. I'm actually seeing 3 friends this week, and I feel like I haven't seen anybody in over a year. Freaking COVID bullshit. So that's good. I'm excited. I'm glad. I'm excited to see people who I haven't seen in a while. And I think it'll be good for me to do some socializing, since I really haven't been able to for, well, nobody's really been able to for the last year. So, all right, we're at 15 minutes, 15 and a half minutes. This is probably the shortest video I've done in quite a while. So just keep me in your thoughts, and we'll see what happens. All right, happy Wednesday. Oh, Wednesday, it's hump day. Happy hump day. Hope everybody's having a great day, and there's that. All right, see ya.